Good afternoon. My name's Anne Connolly. I'm a local GP and I also am the Women's Health Lead for the CCG, and today we're going to be talking about Ovarian Cancer Awareness. This month has been Ovarian Cancer Awareness Month, and it is a call to action to try and encourage women who may have symptoms to go and see their GP and to get this problem if they have it diagnosed earlier. The reason this is important is because the diagnosis of ovarian cancer is not easy to find, not easy to notice. The symptoms are often very vague and women are often diagnosed late. If you are diagnosed with any cancer late, that means the outcomes are going to be worse. So the main point about ovarian cancer is it is not as frequent as some of the cancers, but it is important to think about it, consider it, and for women who might have symptoms to go and talk to their GP. Now, what is ovarian cancer? What are our ovaries? The main cancers that we see in women are cervical cancer, and this is a problem that affects the cervix here. Now, the reason we do well with that in the UK is that we have the cervical screening tests. So, as an aside, if you haven't had your smear test done recently and it's overdue, or you don't know when you're due it, please contact your GP. The next cancer that we see in women is cancer of the womb, and this is the womb here. And women who have womb cancer, on the whole, will go to their GP because they will either have a change to their periods or they will have some bleeding later on when their periods are finished. So they may have had their last period 5 years ago and have a bleed. And obviously you go and see your GP and you get referred. Now in women we have two ovaries. The ovaries sit here on either side of the womb, but they are tucked away inside the pelvis, inside the abdomen. So we don't know about them if they get a little bit bigger or if they have a problem. It's not an easy test. We can't test for it easily, we can't see it, we don't feel it. And that's why ovarian cancer is such a problem. So, what are the symptoms? The symptoms that women might experience, and this is usually women who are over the age of 50, the symptoms they may experience are very vague. They might be feeling bloated all the time. They might be feeling full after eating. It might be that you've had a change when you go to the toilet, so you either pass urine more frequently, or you might have diarrhea and then constipation, and diarrhea and then constipation. Or you might just get a persistent abdominal pain. If you have any of these symptoms and they are persistent, so they go on for several weeks, then please consider going to see your GP. Now, another online resource is this. This is published by Ovarian Cancer Action. So you go onto the Ovarian Cancer Action website, and this is a symptom diary where you can keep a diary of the symptoms that I've just discussed and see if they are persistent. And if they are, you take this, print it off, take it to show your GP, and then they might be able to decide whether or not you need more tests. So who is at risk of getting ovarian cancer? Well, firstly, it's pretty much any woman, but particularly women who are aged over 50, they are more likely to have a problem. But there are also some women where it runs in families. Now they have the genetic type, and this is also linked in with other genetic cancers such as breast cancer. So if you have a strong family history of breast and ovarian cancer, and this means your mum, your sister, your mum's sister. It doesn't mean your great-great aunt or a cousin from a far distant family. This is a first-degree relative. And again, there's a resource to help you on the Target Ovarian Cancer website. The Ovarian Action website. And this is a tool that you can use where you can click on this link and they will ask you some questions. And if it suggests you have a strong family history of a problem, you could go and talk to your GP about whether you should get some genetic testing or not. So, in summary, ovarian cancer is important. It's important because we're not diagnosing it quickly enough. There are some very useful websites, and we will put them on the bottom of this on the Facebook page. The main ones are the nhs.uk ovarian cancer link, Target Ovarian Cancer, the Ovarian Cancer Action websites. They have all got lots of information on, and obviously we have our own local resource, which is the Cancer Support Yorkshire.co.uk. So finally, this is taken from the Target Ovarian Cancer website, 10 top tips for patients, for women to consider about helping you decide if you might have ovarian cancer and you need something doing about it, or to discussing it more with your GP. So I'm hoping that's helpful. Think about your risk, think about your symptoms, and then go and talk about them. Thank you very much.